Health officials confirm the first measles death from the ongoing outbreak has been reported in West Texas. This is the first death from measles in the U.S. since 2015. The victim, an unvaccinated child who had been hospitalized in Lubbock. This is according to Texas Department of State Health Services. Dr. Linda Yancey, an infectious disease specialist at Memorial Hermann, is here to talk about the disease and how to prevent its spread. Good morning, Dr. Yancey. Thank you so much for your time.
Good morning.
Define for us, if you will, measles and how it impacts people.
Measles is an airborne disease. It causes upper respiratory infection, pneumonia, a rash. The vast majority of people will have mild disease, but some people, about 6 to 8%, will have severe disease, and it is absolutely deadly in the very old and the very young.
What are signs and symptoms?
So the first signs are a runny nose, a sore throat, and reddish eyes. In about 3 to 5 days, that rash right there will blossom. It starts on the face and spreads throughout the body.
We mentioned this child was unvaccinated. Talk to us about prevention and treatment.
The vaccine is highly effective. It's 2 doses. 1 dose gives you 93% protection. 2 doses gives you 97% protection. And that protection does last for a lifetime. And that's the good news. The bad news is there is no treatment for measles. We are not good at treating viral diseases. The best we can do if your child develops measles is give them fluids and Tylenol.
Criticism we're hearing from folks who say, you know, they've been vaccinated. They're wondering or they're skeptical if they can catch this disease. If you are vaccinated, can you contract measles?
Unfortunately, there are conditions that can occur after vaccination. People develop lupus, rheumatoid arthritis, anybody on chemotherapy, anybody who's been transplanted, you are susceptible because you are immunocompromised. So we have this pool of susceptible people, even though they've been vaccinated. And that's why those of us who do not have immunocompromising conditions, it's so important for all of us to be vaccinated to protect the people around us.
You mentioned protection from that vaccine is lifetime. Is there a need in certain situations for people to get a booster shot?
So anybody who was born after 1957 but vaccinated before 1968, when the newer, better vaccine came out, you do need a booster. If you are wondering, gee, do I need a booster? Talk to your doctor, because there's a blood test they can run to check if you have protective immunity. It's called a titer.
Yeah, having that conversation can be really critical. For folks listening this morning, watching this morning, what do you want them to know about the spread of measles in 2025?
Measles is the most contagious disease that we are aware of in medicine. It spreads like wildfire. It is very concerning that the cases have been increasing at such a rate, double digits every day. We probably have 3 to 4 weeks before it really crashes down on us in the Houston area. And that means that now is the time to vaccinate your children. Now is the time to get that booster. It takes a few weeks for that protection to kick in, and we only have a few weeks before the storm hits us. Get the vaccine now.
And at the very least, now is the time to have that conversation with your physician to see where you are, if you're in need of a vaccination, if you haven't had one, or that booster, as you mentioned.
Absolutely.
Okay, all good information. Dr. Yancey, as always, it's a pleasure having you on the show. Thank you for your time this morning.
Thank you for having me.
It is 8.